I'm Dr. Mitch Elkind, the Chief Clinical Science Officer of the American Heart Association, and I'm here with Colleen Spees, who's one of our investigators in the Healthcare by Food initiative. And Colleen was just presenting her work, her pilot trial called Sustain, that she does with a group of collaborators. And so we're going to hear about her study and talk a little bit about the Healthcare by Food initiative. So Colleen, tell us a little bit about Sustain.
Great, thank you so much. So I'm happy to be here. And again, you mentioned my collaborators at Ohio State University, and that's Dr. Joshua Joseph and Dr. Dan Walker. And we came together and leveraged a lot of the expertise that we had already built in the academic, community, industry, and government partnerships that we have established. And we came up with this trial, Sustain, that we're thrilled that the Healthcare by Food funded us in supporting us on this wonderful trial. So basically, we know that in stage 2, cardiovascular kidney metabolic syndrome, we have a lot of participants. It's a great opportunity, and there's so many people who are Medicaid eligible that are, and also nutrition insecure, that are plagued by stage 2 CKMS. Many don't even know it. So what we were trying to do, and we thought it was an opportunity to put in a food as medicine initiative where we could intervene early in stage 2, and we could try to prevent the onset of the disease, the advancement of the disease, and maybe even reverse some of the symptoms that are cardiometabolic in nature. So that's what we've been doing. It's a 24-week randomized controlled trial, and we're finishing up now. And I will say we are just thrilled with the progress. We were able to meet our recruitment goals within 5 months, and of 100 people. And what we offer them is a multifaceted intensive intervention. And the several components of that include providing them $100 every 2 weeks in vouchers for the first 8 weeks to Instacart, where they can purchase healthy foods. And we also provide nutrition counseling, behavioral counseling, and that is in a hybrid format. And we provide that by interventionists that are trained dietitians and also who have extensive training in motivational interviewing. We give our intervention group access to food pharmacy, which is part of our collaboration with the Mid-Ohio Food Collaborative. And with that, they get a card and they can go get extra produce once they are registered and set up in the system on a weekly basis. And we also have wonderful partners in Health Impact Ohio, which assesses social needs for those that need a pathway to help them to meet their social needs. And I should mention the other collaborator is our cooperative extension agents and educators who help with culturally relevant cooking demonstrations and also cooking demos and taste testing and all those types of things. So it's a big, happy team, and we're doing some great work.
That's phenomenal. First of all, I love the way that you bring together 2 major Heart Association initiatives. One, of course, is Healthcare by Food, our Food as Medicine initiative, but also you're working in cardiovascular kidney metabolic health, which is a big area that we've recently launched also. So I love the way it brings those together. I have to say, you said it's a big team. You're doing a lot of different things. There's food involved, $100, as an incentive or voucher for food. But there's a lot of coaching and education and addressing other social needs. Can you say something about how important those other elements are to a food as medicine program? You're not just dropping a box of food at somebody's door and walking away, right? You're doing a lot more than that. Can you talk about that?
We sure are, because we've known for a long time, and in many of our other interventions that we've done in the space of helping those that have social needs and also food and nutrition insecurity, that we really do best when we provide the opportunity for an a la carte sort of approach where folks can pick what works for them at that point in time. And I will say that tailored approaches we haven't seen to be very effective over time. We do need to figure out what the active ingredients are as we move forward and hopefully scale up in terms of what's best and for which populations, because I think we'll be able to tease that out with larger trials. But I will say, it has been such a pleasure to work with the American Heart Association and Healthcare by Food specifically, because this framework by which this is all based is so wonderful for investigators at any stage in their career. So, for those that don't know, they have an entire cooperative studies team that the researchers who are funded have access to. And I mean, and this includes things like training in implementation science and in human centered design. And if you need statistics support, all of these things, it is just amazing. And I've been around a long time and I've been blessed to have a lot of funding from organizations. And I will say, I've never seen such a seamless and beautifully supported trial situation. And with that, you all have built this consortium of investigators with 20 trials. And I'm now actually collaborating with some of the other investigators that I've
Mm.
met right here through this Healthcare by Food and all of the, when you bring us all together to share learnings and talk about best practices.
Yeah, well, that's great to hear, and thanks for pointing that out. I mean, you're right. Food as medicine is a complex enterprise, and we're focused on the research, but we do have sort of an envelope of other activities around the research and the studies like yours that you're doing. Our advocacy and policy team are working on those aspects. We have a patient lived experience group that's working on that. And as you say, the cooperative studies group includes task forces on behavioral science and cost effectiveness analysis and health equity and so forth. And we've learned that for food as medicine to really work, we do need to be firing in all of these different cylinders, essentially. You mentioned the convening that we had back in the fall, which brought together not only investigators, but also food providers, food
Mhm.
marketers, delivery services, health insurers, physicians, and so forth. It's really building an ecosystem to make this work. And I thought that your comments were really helpful in that regard. Thank you for that. Um, can I just ask you, you used to work, I know, in cancer and food is medicine and cancer. And I'm just wondering how similar cardiovascular medicine is to cancer. I mean, I often think of patients with cancer as doing everything they can to get over this kind of acute illness or, the acute phase of, let's say, cancer, the chemotherapy and so forth. And in cardiometabolic disease, we're dealing with, somebody's future, their life, it's a lifelong illness that they're going to have. Um, are there differences in the psychology of patients being
Mhm.
involved in this kind of a program?
Yeah, that's a great question. And it's true. I came from the oncology field. And then when I realized people, because of technologies and earlier detections of cancer and immunotherapies, they're living longer. And what we're finding is a lot of them then go on to die of cardiometabolic issues.
Mm,
So that got me into that cardio oncology
mm,
space. And I think it does bring a different perspective for sure. When folks are diagnosed with cancer, uh, you know, they have what we call a life scare. And if you catch them at a moment in time, we call those teachable moments
mm,
where they're really receptive to hearing everything they can do and help me. And I will say that in stage 2 CKMS, a lot of people don't even know they're diagnosed with that at that point, right? So again, we can catch them early and hopefully at a teachable moment, not to scare anyone, of course, but to say, we have an opportunity here to keep you
mm,
from going on and having, more aggressive kidney issues or something like that. So I think that it's different, but everybody wants to do the best they can. And they are receptive if you approach them in a way that you are offering them and their family. And I think we need to broaden it to the families also as we move food as medicine forward to really help to prevent all diseases because we
mm.
know over 80% are related to diet related chronic diseases, no matter what it is. But it's a great question. And we are seeing differences in the way we counsel patients, be a cancer patient who's just had this life scare at a teachable moment versus somebody who the physician said, oh, by the
Mhm,
way, you have this thing called stage 2 CKMS, right? And what does that mean?
mhm,
So these are all learnings,
mhm.
but also why it's so important that American Heart is supporting this and allowing us to try to move forward in these ways and figure out what we can do to support our patients, especially those who are food and nutrition insecure
Hmm.
because they have 50% higher rates of food insecurity, right? So, or those that are on Medicaid have 50% higher rates of nutrition and food insecurity. So we need to be really cognizant of that and be wrapping our arms around folks and really supporting them in any way we can.
Oh, that's terrific. Um, it's not easy what you're doing, these trials, I think. Can you say a little bit about some of the challenges you've faced in doing this kind of
Mhm.
research?
Well, I will say that we are fortunate because we have already built this great infrastructure, again, that um, collaborative approach at Ohio State. And Dr. Dan Walker is a systems person. So we each bring our expertise to the table. And because we've worked together in the past, we all seamlessly sort of move things forward. But then we have this greater outreach with the partners we've worked for. But they are excited about this food is medicine type of thing because they all are on board. And they're like, why are we not doing more of this, right? And again, food is medicine doesn't mean it's replacing medicine. It means it's a partner in the treatment of all diet related chronic diseases, and it should be part of the conversation. And that's what American Heart and Healthcare by Food is doing.
Yeah, for sure. What do you think is going to happen in the future? What are the next steps after this study for you?
Yeah. Well, I've been in the food as medicine space without calling it food as medicine for over a decade, and I will definitely continue this work because I see such value in individuals adopting healthier lifestyles, not just food, but
Mm.
also stress reduction and sleep health and decreased tobacco use and all the things that Life's Essential Eight brings to the table as
Yes.
well. And I think that's what we need to be looking at, supporting people on their journey towards healthier and modifiable lifestyle behaviors. And I think that, again, I've been a dietitian a long time too, and I never thought we'd see the conversations in and around food that we're seeing
Mm.
now. And it's decades late, but better late than never.
Better late
And I
than
will
never.
say, in our current climate where people aren't sure what's going to happen with funding or whatever, I find that if you keep focused, there's great opportunities sometimes in the midst of chaos. So I'm keeping my eye on the ball, and I think we all have to keep doing the work we're doing and focus in and keep helping people because that's what it's about.
Colleen, your optimism is so inspiring. Thank you for that. Um, People can learn more about the Healthcare by Food Initiative at www.healthcarexfood.org. It's healthcare by food, but with an X for the by. So hope to see you there, learn more about what investigators like Colleen and others are doing. And thanks for joining us.